It means for Washington State that we can have peace of mind, that we won't have to worry, that we'll lose health care if we lose our job, that our children will lose health care, that our parents may be subject to huge costs if they have a pre-existing condition and their insurance denies coverage, or somebody else has a serious illness and their policy is canceled. All of those anxieties, all of those concerns evaporate. They disappear once we have a guaranteed approach to health care for all citizens. There are several different ways to pay for it. There's incredible waste and duplication already in the system that is not booked, is not accounted for in the way the calculations are made. For instance, right now, everybody who has health insurance pays an extra $1,000 a year out of their pocket for their premiums and so forth to go to pay for the people who are not covered that go to the emergency room. So it's a cost shift that everybody's already paying. Well, when we have everybody covered and they're not getting cost shifted, guess what? That $1,000 that we're already paying, hello, that's your money now. So there's a lot of system-wide duplication and waste and cost shifting going on that will evaporate, will be eliminated once we get healthcare reform underway. You know, the most important thing for people now is to understand that change is always difficult. And for people who represent us in Congress, it's hard to overcome the huge lobbying effort of what I call the medical industrial complex. They're spending over $1 million a day in Congress right now trying to stop change. So what citizens need, I think, to do would be to reassure our senators and our representatives in Congress that this time we need change and that what we have now, the status quo, is not acceptable. We need to fully understand some of the local concerns, and so we want to make sure that people here in Washington State have an opportunity to speak out about what their concerns are. Everybody has a different perspective, and it's very important for us to understand what those perspectives are. But I have to say, we also have to understand them in the context of how do we achieve change that will provide health care for all of us. Absolutely am. We've never gotten this far on health care reform, and it's been tried at least 6 times, maybe 8 times in the last 100 years. We have the best shot we've ever had this time.